Welcome back. Well, the DA in Limpopo wants the Department of Health in that province to explain the alarming child mortality rates. The province recorded more than 24,000 child deaths between 2013 and 2023. This has put Limpopo in the fourth position among provinces leading in the number of child deaths. Well, joining us is Neil Shikwambana, who's the Limpopo Health Department spokesperson. Neil, thank you so much for your time and thank you for joining us on Daytime Update. Has the provincial department been able to determine what's the cause for all of these child deaths?
Look, I think thank you for having me. I think we need to start from the beginning, especially basing it on the intro that we've just given to the viewers to say the stats are alarming. There's basically nothing alarming about those stats. It's just that the Democratic Alliance wanted to create that impression that the statistics are alarming. And I'll tell you what, I'll tell you why, without necessarily sounding as if we're trivializing these things, because these are people's lives, these are important lives of children, but we would need to locate this argument within a particular context so that we realize what exactly is happening. So if you look at it, the Democratic Alliance has used a 10-year period to determine this, to say it's 24,000. Correct, because they took that from our response that we sent to the Minister in Parliament. Now, if you take an average of that 24,000 in 10 years, it would tell you that you're actually getting 2,400 on average on an annual basis. But that needs to be looked within the context of basically how many people are you also dealing with in the facilities. For instance, let me give you an example with only children that were born in our facilities. In the previous financial year, which is 22-23, we had almost 124,000 new babies which were born in our facilities. So if you look at that only, bounce it with a figure, it then tells you that we are at about 0.9% in terms of infant mortality. But also I think the numbers, again, when you look at them, they actually can be a little bit deceiving, because what exactly are you comparing us with? Because I think one of the arguments that the DA is making there is that we're number 4 in the province, hence this is alarming. But if you look at some of the provinces that are compared with, they've got a small population, and they're handling very few cases of children. So we're saying this is a challenge that we are looking at, that we're dealing with, but certainly not an alarming issue as the DA wants it to want people to believe out there.
All right. Well, in the letter that was addressed to the department by the Democratic Alliance, it's also seeking clarity on how many cases of medical negligence could have potentially led to the child deaths that you've just reported to us. Notwithstanding the narrative that has clearly been created here, is there a linkage to cases of medical negligence when it comes to child mortality within the province?
Not at all. Fortunately, in March this year, we've just held our medical legal conference, and the person who actually wrote this letter to the MAC is a member of the Portfolio Committee on Health, and he is actually privileged of the information that came out of that conference. In fact, what came out of that conference indicated that over 90% of the cases of medical legal point to actually what we call cerebral palsy, which you can't naturally pin it down on negligence, firstly, and these are not these do not involve issues of mortality or death of small babies. And then the other part of it would be your obstetric and gynae cases, and also your orthopedics cases. So in that report that was given, or rather that overview that was given in that conference, nothing points towards that. We think that maybe the DA is just trying to play politics by trying to link issues that do not necessarily relate to one another here. And what I need to emphasize again is that the issue of death in facilities, especially if you're looking at it from a point of view of small children like this, should not actually, it's a serious issue to us. and we are not in any way trying to trivialize it. We're saying it's a challenge that we're dealing with it. And by the way, if you look at infant mortalities, especially when you look at children who are being born in facilities, the deaths of children that are being born in facilities, we have been able to improve, if anything, from about 182 per 100,000 from 2016, and now we're sitting at below 80 per 100,000 births. So there's kind of progress that we're making there, because this is a challenge that we're confronting and dealing with. And to paint this as an alarming issue, it's quite disingenuous from the Democratic Alliance. And we think they're utilizing a very serious issue to play politics, and it's quite unfortunate.
Something else that's interesting to me, Neil, is the actual reporting of these child deaths. I wonder, because, you know, once a child is born, of course, the family, the parents are able to take their child home with them, and sometimes deaths occur within the home. Can those still be linked back to the hospital if they haven't taken place within the parameters of the public health facility itself?
Look, I don't think so. I think the numbers that count there are those that actually lost their lives within the parameters of those, or inside the hospital facilities when they're being taken care of. This could be the children who were who had just been delivered, or children who were under 5, who came to hospital because of certain ailments. And I think pointing towards that as well as another factor that we have actually identified as one of the challenges, as I said, it's a challenge that we're dealing with, is that the link also, if you look at what the DA said in their statement, they're saying issues of diarrhea and also pneumonia are amongst the highest causes of these deaths. So when you look at those causes, most of them point towards the issues of HIV/AIDS. So you might want to look at it from a point of view of pregnant women who are from within the borders and outside the borders of the country, who might have come to the hospital just only to give birth, or to the facility to give birth, only to discover that they are already HIV positive, or delivered without necessarily knowing that they're HIV positive, and they could not be covered by the PMTCTI program of the department to ensure that these children do not get infected by HIV. And some of them then get these kind of ailments that I've mentioned here and demise. So there's a whole lot of factors that surround that, more than what the GA would want the public to believe.
You know, Neil, I don't think it's lost on our audience the fact that public health facilities are one of the most severely under-resourced. When we talk about, you know, the public sector, it's almost become a bit of a trope, really, when we discuss how under-resourced certain public sectors are. When confronting the challenge of child mortality, as you've just elucidated for us, talk to us about the reality of that, facing the challenge at the same time of being so heavily under-resourced.
Look, the issue of under-resource, the under-resource of public facilities, it's actually not a secret, it's a known issue. But also, if you look at the numbers that were presented to you, they do not necessarily paint a bad picture. They are saying to you, under the difficult circumstances of under-resource that government is operating under, it's still able to do its best. Because also the understanding should be that the public health care program, as any other healthcare program, is not a perfect system. There are issues and challenges from time to time that must be dealt with and be confronted with. But I think under the circumstances, the public, and especially on the issue that we're dealing with here, the public health system is actually doing fairly well. Also considering that majority of people that give birth in this country, and also who are coming from outside the country to give birth in the country, are actually utilizing the public health care facilities compared to any other facility that we can want to compare it with.
All right, Neil, thank you so much. We'll leave it there for now. That's Limpopo Health Department spokesperson Neil Shikwambana.